Connected by purpose, driven by passion. This is Children's Healthcare Canada's Spark Live webinar series.
Children's Healthcare Canada would like to thank the following Keystone funding partners for their ongoing contributions that support all of our programs and activities. The Stollery Children's Hospital Foundation, BC Children's Hospital Foundation, the Children's Hospital at London Health Sciences Centre, the Alberta Children's Hospital Foundation, the Children's Hospital of Eastern Ontario, and Holland Bloorview Kids Rehabilitation Hospital. We would also like to thank the organizations that provide funding for our knowledge translation activities, which includes this Spark Live webinar series, the Spark Conversations blog, and the Knowledge Exchange Network. To learn more about Children's Healthcare Canada, you can go to our website, follow us on Twitter or Facebook, or you can sign up for our weekly Spark newsletter at childrenshealthcarecanada.ca/email, where you will learn about upcoming events, read the latest posts from our blog, and other exciting news and events from across the child and youth healthcare community.
Hello, everyone, and welcome to this special edition of Children's Healthcare Canada's Spark Live webinar series. I'm Paula Robeson and your host for the next hour. Spark Live is where we gather each week to curate, convene, and showcase excellence and innovation from across the child and youth healthcare community. And our goal is to spark conversation, ideas, and action. Since we're live, I want to remind everyone that while we don't take questions over the line, you all have the opportunity to type your questions into the question box at any time. I'll check periodically for the questions and we'll respond to them at the very end of the webinar. But please don't feel you need to wait till the end of the presentation before you start typing. Go ahead, put them in as you think of them. We're all delighted to be joined today by colleagues from our members in home care and respite services for the webinar Challenges and Solutions for Delivering Home Care and Respite Services During COVID-19. This webinar focuses on the impacts of COVID-19 on home care, residential, and respite care, its impacts on families, and implications for integrated pandemic planning, inclusive of this sector in the future. For those of you on Twitter, please tag us at ChildHealthCan to any webinar-related tweets and go ahead, share away. I would like to welcome our speakers for today. Susan Bazilian is the Chief Executive Officer for the Safe Haven Project for Community Living, and Kyan Fu is Vice President, Practice and Quality at St. Elizabeth Healthcare. It's my pleasure today to pass the mic to Susan.
Good morning or good afternoon to everyone. It's a real pleasure to be here today and share with you the experience of a community-based organization navigating this global pandemic. Certainly, I have quite a lengthy career in health and also have been involved in the accreditation work nationally and internationally. But I think today I need to add that I'm also a mom of 3 and I have a son with complex special needs. And really this has been a shift for me in the last few years to really come to this sector to make a difference. And I think being here during this pandemic has really reinforced for me, why I'm here and the work that needs to happen. I think the pandemic presentation I'm giving today, or on the pandemic, you'll really get to see how we've been really open and transparent in our approach. Certainly, there's been a lot out there about the impact of this on children and families, especially around some of the visitation. And I hope that my presentation will highlight some of the challenges that we were dealing with in the sector and how we partnered with families and really tried to move forward on this. Safe Haven is in the GTA. We have 5 locations. We service over 200 families for respite. We do have clients who live with us who actually are under the protection of Children Aid, and also some other children who live with us for many years. Just move down. My screen is froze. So first I want to start off by talking about our manifesto. This really speaks to who we are. We've done a lot of work to really identify, we do strongly believe that our clients belong. Nothing will test you like this will. It tests your patience, your spirit, strength. It changes what you care about, who you care about, what you appreciate. It impacts your goals, your dreams. It's one of the biggest hardships you'll ever endure, but finding life in difference, that's rewarding. Rise above perception, rise up to resilience. We all belong. This is just a high-level overview of the work we've done over the last few years in terms of really transforming the organization, really sort of having a strong focus on our clients, recognizing that they are exceptional and we want to provide exceptional care, strong focus on quality and safety, and partnerships with families and individuals throughout the life cycle. We also embarked on, it was an organization that was grassroots, so a lot of work to professionalize the organization and really embrace the standards from accreditation. In this particular slide, I just want to identify that we're all working under situations that are unprecedented, which we all know. I think in our sector, in the community sector, we've been very vulnerable. I think, and some of that is really looks at how we're organized in our province of Ontario regarding health. But what I really want you to understand is the things that we've done today has come from a variety of sources. I've been reaching out all across the country to partners, to my colleagues, and in the absence of direction, really sort of doing what we felt was right for our organization and our children. So as we know historically in Ontario, we are working towards an integrated health with our Ontario health teams. We have started that with the new government, and certainly I think that some of the things that has happened over the last 8 to 10 weeks are really positioning us well for an integrated health system. So my message to the ministers as I work with them is we can't go back. And I'm sure that this work is going to really drive our direction even forward more. The one thing that we really, in terms of some of the challenges, is the disparity in the system. Certainly in relationship to similar professionals doing similar work, there is disparities in salaries. There's also challenges we had in terms of the infection prevention and control, in that our sector really did not benefit from having a strong sort of platform on infection prevention and control. And as the pandemic hit, rightfully so, a lot of the resources really were really enabling the acute care to get set up, the critical care beds, expanding capacity, getting ventilators. But during that time, there was a sense in our sector that there was something that was lost, so people did not receive that support. Access for personal protective wear was extremely challenging. We had orders in for personal protective wear from January and February, and our orders were froze. Many of the vendors actually indicated to us that the products were being directed towards the acute care. So we had to be extremely creative in terms of how we came together individually and as a sector. In terms of Safe Haven, we're a hybrid organization in that we have medically complex children who are technology dependent, and we also have individuals who have a lot of developmental issues. So we actually cross both ministries. We are predominantly funded by MCCSS, but we do get some funding for health. And even in a normal situation, that has its challenges, but I think in this situation, it also highlighted other issues. As we started, two of the foundational philosophies that I really tried to embrace was really the notion of safety and compassion. So in the absence of that direction, it was really sort of relying on my experience in multiple avenues and really look at how could I really do this in a way that every day when I, woke up and looked in the mirror, I felt like I was doing what I needed to do. And part of that was really being having this three-pronged strategy, which was to be very proactive early on. We started our work at the end of February, and we have been really pushing that work. Also being very relentless in terms of advocacy. Certainly, I never thought I would have to do as much advocacy as I have done, but I think certainly it has been a real privilege to work with some of the individuals in our local, provincial, and federal government, and also then the connections with the community. When I say the community, the immediate community, but also the health community and everywhere else, and even some of our board members and their companies. So in terms of being primarily very proactive, as I said, our philosophy was around protection of life. We knew that if our children and the young adults did get sick and get COVID, that it probably would be very challenging for them to survive. So with that notion, we really put in what I call a real lock and load sort of an approach early on. We always did passive screening, but we really early, sort of at the end of February, early March, went into active screening, every shift, doing temperatures, doing the travel history, but also, screening for all the symptoms. Implemented the mask at all times. We always had strong cleaning protocols, but we did enhanced cleaning and twice daily. We also then increased deep cleaning with our external providers and the hand hygiene. And I have to say that this was extremely important right up front for us because we couldn't get access to some of the PPE. So in the absence of having the PPE, we know that, from our standards around, accreditation and health is that there are many components to strong programming. So I really think that this work saved us initially. The other thing was to really lock down the staff. So from the start, we actually had a goal of having a 30% buffer for our staff. So we converted all of our part-time positions to full-time positions. We did ask staff to make a choice between us or to work in other jobs. We have people who are working several jobs, and with that, they were given unpaid leaves. We had also many staff who were finishing up their RN degree programs and were being offered positions in other sectors in acute care. We did create that job class of RN because we really needed to ensure that we kept those individuals during the COVID. However, we are working with our partner organizations to look at down the road, how can we help facilitate that transfer of positions into those acute care settings or wherever they would like to work. We did temporarily close our respite. However, we are on a crisis basis. We're high engagement with sort of what's happening with our families, and really making sure if somebody is in trouble, which we do have some situations that we have responded to. So it's treated as a one-on-one. The visitation for visitors and family members, we did have one visitor, and then as it progressed and we saw the impact, we did reduce to no visitation. However, we had a very thought out strategy in terms of working with the families, identifying sort of how we can communicate with them through phone, iPad technology, Zoom meetings, you name it. We did everything to really embrace that sort of high touch with families. And certainly to date, that has worked for us. And also then in terms of what I would say is that our digital transformation, we had that as a goal for us to do, but certainly this this particular crisis has accelerated that and helped us significantly, especially with communication as we move forward. In terms of the connectivity, again, this was a huge piece for us. Listening, I would say we listened and supported and changed practices to support sort of staff and our families. A lot of two-way communication, daily COVID touch points with frontline staff, regular town hall meetings. And we wanted to create a space where it wasn't sort of a strategy of senior leadership or myself. It was a strategy where the staff were involved and evolving that with us. So I think that really helped us with the engagement. We actually worked on, we are a Studer organization. So part of that work in Studer and that sort of evolving our leadership, we really sort of embraced that and say, how can we actually come out of it on the other end? Not only saying we got out and we were okay, but also that we actually helped use this as a platform to grow our staff into leaders. So I'm very proud of that work that we've done with Studer. And the personal phone calls, we have one person who's dedicated directly to speaking to families. I've had Zoom meetings with families. I've had support groups with families. I've had 2 sessions this week. I've got another one this afternoon. So I think the whole focus on the mental health component has been huge. And I did recognize that I struggled in that I probably felt that I needed some more support around the mental health component. So we hired a psychotherapist to actually help us with some of the fears and anxieties and the emotions and the impact of social distancing. And I think that has really helped us. And with the Studer component as well, I think with their help, we evolved the one-to-one rounding so that we did that with our families, and we also with our Children Aid Society caseworkers during their communications to make sure we were hitting all the elements that we needed to do and we were responsive. We've also created sort of a safe haven self-care corner, and that's really to help staff and the broader community and our families with some of the mental health components and the social media. So we've had a lot of focus on social media and looking at we created a portal on that for our clients. In terms of the Relentless Advocacy, I just want to say that this has been a time where we have been very active advocating on many levels, local, provincial, and federal, in terms of the need for supports for vulnerable individuals. I think that early on, like I said, it was concerning when we were seeing some of the frameworks, but I think based on how the COVID virus has impacted the vulnerable sectors, we are seeing that people are really supporting us. I've had people who just are calling to see how I'm doing. People who know our clients are worried. So there has been a real sort of support from the community and people to make sure that we, wherever possible, that we're doing all we can so that none of our children pass away because of COVID. So active engagement with our key ministries, bringing awareness to the critical needs of Safe Haven, but also our sector. Our sector has had significant challenges on many fronts around products, around PPE, around communication. I think our public health has been overwhelmed. So there's been so many challenges just receiving support. And I think I'm very proud of the colleagues that I've worked with in terms of what we've been able to do together in trying to coalesce group work around infection control and purchasing. Also in ways that we're collaborating, we've been helping other agencies with N95. We've been working with our hospitals and our rehab. Holland Bloorview has been excellent to help us with some of the work around mock sort of tabletops if we get an outbreak, donating us PPE. And also the human resource component, there's been a lot of shifts and things that are happening in the sector We've really tried to work together, especially on some of these emerging issues. Here's just a sample across of some of the things that we're proud of, certainly with the advocacy work. I think there's been nights that people who've been working with me have been up all night trying to advocate for the work for our vulnerable clients to make sure we get the supports we need. We've had issues with food delivery and things that our normal sort of channels of food delivery have really backed up because everybody jumped on those. We've had board members who've been out doing runs for us. It's just been incredible, the support. And you'll see there's a picture of one of our families who actually have, I call them our grocery heroes, but they've been taking care of our staff. So we've really redefined our relationships with our families and what that looks like. They understand. I think that couple that's on the right, I spoke to them 2 days ago, and they're saying, Susan, we don't want to come in because we know that it's a very difficult situation, and we want to make sure that we do our part. So it's really sort of, I think the communication and the collaboration is really important at this time so that we all feel like we're doing something, we're doing our part, but we're not being isolated. And maybe that's some of the challenges that people don't feel that they're involved. I just want to end by saying that we also have been doing work on our brand and where we're going. Before we actually, came into this crisis, but certainly we all sort of came from the notion that there had to be something that really spoke to the idea that our clients belong. So that notion of we belong. I want to make clear that we are change makers in the sector. We are advocates, we are community, and we do belong. So if there's any message that I give to anybody across the country, is really that advocacy work for the vulnerable population is really critical. Thank you so much.
Hi, good afternoon, everybody. Thank you so much, Susan. And it's such a privilege to have this opportunity to be amongst colleagues as well as our clients and family members during this challenging time. When we got approached by Children's Healthcare Canada about this webinar, and I say absolutely yes, while everybody is working day and night, working extremely hard, I always take this great opportunity as an opportunity for dialogue, to share, as well as to learn. Usually, well, actually almost 100% of the time, I learn a whole lot more than what I could offer in terms of sharing our experiences. So thank you so much. So I'm just going to move along here. Hope everybody can hear me all right. So I know that during this challenging time, sometimes we need a moment of laughter. And I was talking to colleagues who are organizers of the webinar to say that today I put on my work clothes, my jacket, and I look hopefully presentable as a panelist on this webinar. So just very quickly, so we can actually leave a lot of time for dialogue and discussion, quickly about St. Elizabeth Healthcare. We have rebranded, given our global work, given our national reach, to SC Health. So this has been since last year, or probably even longer. So at SC Health, our mission, why we exist, is to spread hope and happiness. And this is extremely important. And I do believe that for our staff at the front line who are facing the challenging times and the leadership who are supporting them every step of the way, the spreading hope and happiness is what's keeping me going every single day. And I could say that for our staff and for our leadership. So SD Health has over 110 years of history with our core work in home and community care. We also, one of our core businesses is also in seniors lifestyle, for example, assisted living, retirement home living, and we have those businesses across the country, primarily in Alberta, in BC. We also have a huge focus on family caregiving. So if some of you have not had a chance visiting our eliz.com, so ELIZZ.com, that is a dedicated SD Health brand focusing exclusively on family caregiving and our caregivers. We have over 8,000 staff, and we provide care activities across the country in the neighborhood of 20,000 care activities a day. And we're very proud to be Canada's, one of Canada's largest social enterprise, focusing on impacting how people live and how people age and at home today and also into the future. So we're a not-for-profit social enterprise organization. I won't go into this detail, just to quickly, thank you so much, Susan, for sharing those wonderful insights in terms of Safe Haven's courageous work in all areas facing this pandemic. And you know, in addition to those great experiences, insights you have shared, I'm going to be focusing a little bit more on clinical practice and quality during this challenging time. As we, you know, it's been 6+ weeks since, you know, the schools got closed and all gearing up for rapid evolving situations. And then when we look at the landscape of home and community care, then I think that as a principle and values-driven organization, we really look at our organizational as well as the leadership decision-making driven by these principles that are near and dear to our hearts. So as our core business and core mission is in-home and home care delivery, we do truly believe that home is the safest. It's very heart-wrenching to see some of the challenges in our COVID pandemic, particularly looking at the congregate settings in retirement home and long-term care homes and the challenges that we're facing. And home is the safest. And when we're looking at this challenging situation, and one of those core principles is obviously we're looking at home care, we need to continue to really embrace our family and caregiver partnership with our client being the center of everything we think and we do. So in addition to eliz.com and stepping up our efforts in terms of a broad scale of supporting family and caregivers, we also have very swiftly implemented a robocall mechanism to engage clients and family caregivers during this challenging time. These robocalls are through technology, automated calls that are going out to clients and families to give them a preference and a choice whether they would like to continue to receive care through home visiting or through a virtual care delivery. And of course, that is one of the key factors in forming our care planning and delivery is not the one and only. We still rely very heavily on our clinicians' professional judgment, looking at our care planning and care delivery and ensuring that the care needs are continued to be met. So sometimes we call it out actually in some of our own discussions to say that the pandemic has not changed care needs of our clients and families. perhaps the pandemic has changed the way we approach care, the care delivery mechanisms, as well as our thinking around the urgency of care delivery. So we use some of those thinking to inform our individual clinicians' approach to care, as well as our engagement with family and caregivers. So the next is receive care at home based on care needs. To Susan's earlier point, while Ontario is on the path to integrated care, to really look at our way of delivering care and some of the barriers, particularly faced in home and community care, where sometimes, perhaps the fragmentation in terms of the task-specific care, the fragmentation in terms of the multiple providers from multiple organizations providing care in some of our client homes, right? And at times we have clients that are receiving nursing care from one organization. There's no less than 4 or 5 different caregivers from different organizations providing care, and that is a challenge. In addition to, I think, some of our limitations in terms of the amount of care we could provide at home. So prior to the pandemic, SC Health certainly have engaged a lot of advocacy as well as partnership work with our Ontario Health regions as well as our hospital partners. So we have had a number of initiatives on the go, looking at transitions to home, looking at a holistic and comprehensive way of delivering care. And we do see this as an opportunity and particularly highlighted by pandemic, the challenges as well as opportunities to, at a faster speed, to scale and spread some of these transitions to home and streamlined as well as holistic approach to care. The next principle is really to speak to about primary care provider model. So I mentioned that while I talk about care at home and the longer term of care, and also looking at the continuity of care from a client and staff safety point of view. And as an example, highlighted in retirement and long-term care home settings, when we look at the number of providers working in multiple work locations and multiple settings, providing care to our vulnerable population, and that is a challenge. And looking at the reality of home care, we have been, kudos to our CEO, Shirley Sharkey, and our senior leadership. They have been represented at different levels of government, consultation tables and discussions, really advocating the concept or the principle of one care provider per client, rather than the fragmented way of delivering care in our particularly home community care setting. The interdisciplinary approach and the virtual care delivery, with, again, credit to our ministry, particularly in Ontario, that was made very swift decisions to enable virtual care delivery in home and community care. So we applaud to our policy decision makers for those that were enabled to have different ways of delivering virtual care, telepractice, via virtual video conference in that care delivery. And this provides us a great opportunity to leverage our interdisciplinary care approach. So not only to think about who is in the home providing care in person, but also who is through virtual delivery leveraging. So we have had a great stories in terms of our rehab professionals perhaps can leverage the nurse and or the personal support workers in the home to deliver care and also to ensure that our care needs continue to be met. Just very specifically to share some of our key focus from a clinical and professional practice lens with regards to the specific COVID-19 pandemic response. I think Susan has very eloquently spoke to empathy and compassion. And I think this is the time that calls on leadership with leading with compassion, and also looking at making leadership decisions, balancing that while we understand we're sympathetic, empathetic, understanding the fear and anxiety, particularly surrounding this virus. That has been a lot of evolving knowledge and science, understanding the nature of this virus. And still, while, you know, lots of great people are working on the vaccine, on the antibody test, on the treatments, and also stepping up large-scale public health mechanisms. But I think that there's still a lot to be figured out, I would say. So at the start of the pandemic, we have really established our focus looking at keeping on top of our science and evidence, have that evidence to inform our decision making. Client and employee, Susan has already talked about that. The screening, I couldn't really emphasize enough about the critical importance of that. And I wouldn't say that we have, SC Health has figured out all of this so perfectly. No, not at all. We have 8,000 staff as a mobile workforce in all of our, 13 LHIN regions across Ontario, and then in different provinces. And we have been putting in a lot of emphasis to working towards this reliable and consistent practice of employee screening prior to every single visit. So that continues to be a focus, and we have also leveraged our digital transformation platform to put in a digital screener to enable that, to really look at enablers for our staff to be doing this really consistently across the board. Infection prevention control practices, can't emphasize that enough. And it is really a work in progress, particularly for the large employee base, as well as the multiple settings. So as we speak, we are deploying a lot of staff to assist with our retirement and long-term care homes. And we want to really make sure that our staff are supported and equipped with the knowledge, as well as the critical thinking in terms of those working in those settings. PPE, I think there's been a lot of discussion. Just in the interest of time, I won't go into a whole lot of details about that, but also to say that at the system level, with time, there certainly is encouraging to see there's more understanding of the role of home care that plays in this system of our healthcare delivery. And then we're not necessarily the lower priority, and then also the requirement for PPE is no different from really looking at acute care or other sectors that have been from the get-go deemed as essential services. So I think maybe I'll, if there's questions or dialogue, I can certainly go through that a little bit more in details. So far, some of the insights from our experiences working to date, some of the insights I'd like to share on this webinar is I think that evidence and science balanced by empathy and compassion, and our ability to connect with our clients, with our caregivers, and also our staff at the front line. You can never really over communicate, and I would say communication is a challenge and is so crucial. We have implemented multifaceted strategies through virtual town hall, all of those things similar to what Susan has shared, but again, is you can never really over communicate. We take the time to really connect with our frontline staff to understand what truly they're going through at the point of care. Protect the vulnerable and guide sound clinical judgment. We reinforce with our frontline staff the need for reliance on their professional judgment, on their critical thinking. There have been so many different situations. Well, it's really great help to have ministry, have public health directives, but I think the devil is always in the details in terms of the principles, the knowledge behind those directives, and how they are applied to every single nuance in terms of the care delivery scenarios, and the nuances are actually every single day we have new situations that we're going through the decision-making process. We're helping and working with our staff. So lead with compassion and empathy, cannot emphasize that enough, is the understanding. Sometimes I would say that as in a role like myself in professional practice, when I look at evidence, when I look at practice, perhaps at a first glance that it might seem to be clear, in terms of the donning and doffing of the PPE, the meticulous ordering of doing that. We have been reiterating that many, many times, every single opportunity when that comes up. However, we continue to have a lot of questions from our staff and understanding where they're coming from, right? And then that would be equally important when we have questions from our family caregivers, particularly when we are talking about, pediatric populations, the vulnerability, the fear and anxiety associated with really precautions and safety. I cannot really emphasize the ability for us to listen, the compassion and the empathy. And one last point is the technology and innovation. And I do believe that this is an opportunity, and let's not go back, right? So leverage technology, and I'm really looking forward to working with our partners, with our system level policy decision makers, really looking at the wins, the gains that we have had in our virtual care delivery, in home and community care, and let's leverage that, and let's use the pandemic in a very positive light as a catalyst for broader system transformation to scale and spread. So with that, thank you so much, everybody, for your camaraderie, for your leadership at every space in this pandemic response, and I look forward to the dialogue.
Thank you, Susan and Cayenne. We've got a few questions for you both. Where are you at? This one was directed to Susan. Where are you at with respect to having access to adequate PPE? And is your voice being heard at the ministry table around this access?
I would have to say, as I sit here today, it's like night and day. When I was on the last webinar, March 26th, I was really struggling to get personal protective equipment. And I was really using my knowledge around just other infection control. But I have to tell you that after the webinar, I think Logan sent out a link for somebody who actually was offering PPE, JIT. And I immediately responded and said, hey, can you deliver in Toronto? And he said, I am in Toronto. And from there, I just want to really highlight the resilience in this sector. So in working with one of my colleagues, Saul Morello and his group, and Community Living Toronto and Corbrook, this sector has now created in, like, I'd say nanosecond, a shared services. We all do not want to be caught like this again. Our orders were so small that basically people just ignored us. They basically shut us down and sent our equipment elsewhere. And we came together as a group, and really now we have the equipment. The ministry has been coming forward. I had 2 deliveries from the ministry last week, and Holland Review and Sick Kids has helped us. But I just want to highlight this DS sector group that last weekend, all of us came together and we put in an order for close to $1 million. That's unprecedented in this sector. So it's forced us to actually create purchasing power, to redefine our business, And like I said to the group, we're not going back. So I do want to thank the ministry, because the ministry has been great. It was just really tough getting equipment when the focus was really getting acute care ready. And I understand that. I came from acute. I don't have any problems with that, but it definitely was a challenge, but we are in a good spot now.
Thank you. This question is directed towards Cayenne. How is St. Elizabeth planning on delivering service to patients post-pandemic? Will there be enough staff to service the patients in home care?
Very great question. Yes, absolutely. So I think what has been I think it has been a helpful observation in terms of the start of the pandemic. I think out of fear and anxiety, we have had a lot of clients that have requested to put their services on hold. We have had a significant decrease, particularly in the space of rehab therapy services. So for a lot of variety of factors, from a staff's perspective at this moment in time, we do have staff that because of the multiple setting, right, the emergency order, in terms of the need to focus on limiting one work location for retirement and long-term care homes, so that I would be not really transparent to say that has not had an impact on our staff base. But we do have quite committed staff in terms of their passion for home and community care. And then we have already had staff coming forward thinking about having conversations already about post-pandemic, in the sense of our COVID clients, for example, understanding the disease process, understanding what does recovery look like, what are the services that our client population will need. So I think that's a new knowledge base in addition to current clients from a staff perspective. I would like to say that the health, human resources, capacity planning and strategy, we need to also step up the emphasis on that as an organization, which we are doing, right, is really looking at our workforce, looking at, so I think health, human resources, capacity planning and plan is very challenging, and it's also multifaceted, because the business is driven right now still by home care contracts, how home care contracts are actually implemented across the board, right? And then your staff and your staffing somehow is a bit, it has to respond to the way home care is delivered. So I really want to say that I'm really hoping that we're not going back, we're moving forward, we're looking at integrated and interdisciplinary holistic care delivery, and how we're looking at that from a staff or human resources capacity point of view. I hope I've addressed that question. Again, there isn't a playbook, I would say, that is perfectly written at this moment in time, but it certainly has highlighted the challenges for us as well as the opportunities ahead.
Any comment, Susan?
No, I agree. Like, I think there has to be, like, it's been fascinating for me actually coming from health to actually be in this sector during this crisis and witness the human resource issues. I think that organizations that are part of sort of integrated health authorities probably fare better, because they didn't, there's a lot of that communication in a region. And I spoke with people, regarding that. I think in Ontario, the issue that was really tough for us was the fact that we had people doing work, sometimes similar, sometimes different, but they were the same professional groups. So as the focus and the dollars became available to hire staff, that really created a lot of stress for us because we had staff that were being actively recruited. And we had staff, I mean, I became aware of it because we were very high touch with our staff, and it was very hard to hear that people were having 2, 3, 4 offers of employment from health or other sectors. And basically during that process, I just really had to lock it down and sort of address it with you know, the best way I could, and really try to keep them, and then work with the hospitals who were hiring to say, can you really work on this? So I think we're in a better position, but there has to be some recognition for these frontline workers who work in community, who are delivering amazing work. These are people who are taking care of very complex children, kids with transplant. I'm speaking from our end, you know, ventilators, you know, in other settings like this would be, you know, I know it's not acute, it's a stable sort of complex patient, but still there has to be recognition for the work they're doing. There has to be balance in the system around the human resource component and the notion of benefits and salaries and pension. There has to be a complete overhaul. So I do think that when I look at the government and how they've responded during this crisis, I think that they've been very attentive to it. I've been very pleased with the work that I've been doing with the ministries and with the Premier in terms of the issue around the salaries. And last week there was the COVID-19 plan, the 3-point plan that was released for the vulnerable sector, which certainly we've done a lot of work to push for that, but certainly the government has been really responsive. And then on the weekend, they announced that the frontline workers, especially in our sector, would get the $4 increase and they would get the bonus. So I think, honestly, our staff are feeling very supported. I have been open with them about our advocacy. I'm really trying to teach them as leaders in the future, they need to be advocates, especially for these vulnerable populations, but also how it's done. It has to be done in a way that's collaborative with our government. Nobody has really gone through this before in this magnitude and what we're seeing in the community. So I could go on for a long time on this component, but I'll stop there. But I have to say, it's we've landed in a spot now that I think I can take that off the table and focus on other things. But I'm very impressed with the response.
Yeah, I was just going to quickly add that we have been receiving very, very positive feedback from both of our staff as well as our clients and families, looking at our new models of care, right? When we have a dedicated team of providers wrapped around our clients and families and streamline that whole care delivery process rather than the current fragmented with so many providers in and out. That's been a huge, I think, engagement bonus for our staff. And if we could scale that up for looking at how home care is delivered, I think that certainly would be a huge boost in terms of human resources.
We've got a question here from a mom who has a contract self-managed care, meaning she's solely responsible for the human resource aspects and reaching out to home care in her community. And she's wondering how scalable are the guidelines to a single household to advocate for, screen, obtain PPE in those self-managed care contract situations.
Yeah, I think, Kai, you want to start, and I can add in on that afterwards.
Yeah, so very good question. I could only imagine how challenging that might be. And, as an organization that I think the whole PPE situation has been, I don't think it's an understatement if I say heart-wrenching. And, I have personally lost so much sleep along with hair and maybe other things over the whole issue of PPE to our staff. I think we've gotten better as the time goes on in terms of supplies. So we have had individual clients through our, I think, private pay business, right? So in terms of the self-management, I don't think there's a magic to that, other than, for example, I'll share one quick client story. We had an ALS client whose primary caregiver was hospitalized for COVID, and she herself became COVID positive herself, and then she was being discharged from hospital, and there was nobody else in the family that could provide the care 24/7. So we worked for a whole week trying to find the caregiver in the home and trying to ensure there is a sustainable supply of PPEs. I think the challenge is not only at the starting point whether you have enough masks, right? It's really planning to see that how long you actually need the PPEs for, and whether you have a sustainable, stable supply of those things. So that's been a huge challenge. And I cannot really say that there's a magic button that we push to say, here it is. And our whole team with our manager and the coordinator for our business, in particular for this client, that worked for a whole week to put things in place.
So I think I'll just add, I think that really, that's great comments, Kyan. One of the things that I think has bothered me is the lack of, with the lack of integration and the lack of standardization. I think that no matter where you are along that continuum, either acute, post-acute, home, and I listened to this mom who's managing family managed care and actually the dollars, the standard should be the same. So we should basically have, if we are enabling families to manage their programming at home with the dollars, and they're bringing in personal support workers or professional staff, that same lens of infection control and PPE has to be consistent throughout. I think it's, for those moms who are enabling workers to come in and not knowing where they've been, what other homes they've been in, not having access to PPE, not even having the tools to screen, I think that's a challenge. I think that if you were in a system that was highly integrated and organized, we would have the same approach across. And I think that's what I would like to say is that, and even in our situation, we had no direction. The only direction we received was on Easter weekend when there was a home that was struggling in Markham, and there was a call we had to put on masks. So I think access to public health and guidelines is really, really important. Families need to have the tools. It's not just about money. It's also about how you need to manage during a pandemic with infection control practices.
Thank you. The question is, how many families who you typically see who receive in-home respite have chosen to cancel their respite out of concerns for their child?
Kyan, I can start or?
Sure.
So I would say that most families are really nervous. I think a lot of families have locked down. I've had calls with families who are basically working at home and also caring for their children who are disabled. They are very fearful. So I think most of them are just locking down and doing that. So they have canceled respite. There were some people who reached out. There was a couple situations where it was crisis situations where we did step in and provide out-of-home respite. But I think most parents are basically staying put and really sort of making sure that they provide the protection to their children and young adults as needed. Kyan?
I don't have the specific number specifically for our, pediatric population, but in general, again, this is not isolated number for just cancellation from the clients, and it's a combination of factors. And I think overall, we have been seeing about 20 or 30% reduction in our care in home and community. So now with the virtual care delivery mechanism now established, that we are quite swiftly calling our clients, informing them that there's a virtual care delivery component. So hopefully that, I think the services that are on hold out of the fear and anxiety, hopefully we can really have a mechanism to continue the care delivery. And the other thing I think that is also learning on everybody's part is that pandemic is not going to end in 1 week, right? We're in this for a bit, unfortunately, in a bit of a longer haul, so to speak, is the the burden that are going to have been placed on family caregivers is enormous, and I think the need for respite, the need to resume care delivery is going to be more and more. So before we get to maybe another crisis point in terms of care has fallen through the cracks or more family caregiver burnout.
We're coming up to the end. I'll ask you one more question, and perhaps we can share with you the questions afterward and collate some responses to be posted online if that's an option for you. The last question then comes from the acute care sector, who applaud you for your leadership, and they're trying to understand the challenges and the needs across the sector for kids with medical complexity. And their question is, what more or differently can be done from folks in the pediatric acute care sector to support children and families and your providers in community and home care?
So I think I'll start, and we need to start. I think that there's a lot of thinking in, and I'll just think of the Ontario context right now, that we're still there's a lot of people are still silo thinking. I think that we need to think about it from the perspective of that individual with medical complexities in that family. We're not only supporting the children, we're supporting the family. And as leaders, we have an accountability to actually really focus on that no matter where they are. If they're in acute care, rehab, community, home, respite, whatever. And we have created these artificial silos that really are not helping people who are highly complex and have needs. We need to understand that we need to put our hats off. We need to get at the table, and we need to build integrated systems. When I think of the work from the kids in Ottawa with the application for Kids First, those are the types of models we need to work at. It has to be done so that it's focused on the individual and family. And as I read that manifesto right up front, and it is really important that we really take a second look and support these families so that they're not out there feeling like they're just drowning. So I don't think that we have enough leaders in the system yet that can actually really look at it from the lens of the parents and the clients. So I'm hoping that after this, we're going to be able to really sit down and have some meaningful conversations around integration.
Good points made, Susan. I'll just quickly add that we have had the fortune of having great partnership with Sick Kids, for example, right, through a quite large scale, the Connected Care project. So that had been going really well from, standardization of practice across multiple sectors. And, some of the challenges prior to that, I think, was particularly from our families' perspective, right? If they were in an academic, world-renowned acute care setting, receiving care for their children, and then when they're discharged to home and community settings, sometimes they're perceiving the standards as not the same, and they worry about that, right? So I think through that work, there's been a lot of shared learning in terms of the home and community practice settings, and I think the support has been phenomenal. phenomenal. The whole PPE and the IPAC discussions that we've had, I think it's through informal partnership. I think at this moment in time, to Susan's earlier point, is who do you know out of the pandemic crisis management mode? Who do you know? Who can you call upon asking a question and getting a solution and move forward rather quickly? So of course, in a more integrated system, hopefully these things are happening by design, not by informal partnership or by who do you know, who can you call, right? So I think that's a great opportunity for us.
Yeah, and I just want to emphasize, I know I was talking about formal, but I can't thank enough Holland Bloorview and their leadership in helping us in terms of mocks and PPE and giving us their brains and their energy, and the Connected Care team at Sick Kids. We've had kids that were sick as well during this. So the complex care team at Sick Kids have been phenomenal in helping us manage kids at home as much as possible. So, but to Kyan's point, it's all done sort of just based on, goodwill, and that there has to be the structure and the process. So it's cemented, and it's not just sort of, people just doing it sort of informally.
Thank you both, Susan and Kyan. Thank you for a great presentation and webinar, and we'll follow up with you with the questions.
Thank you so much.
Oh, you're very welcome.
Everybody, and virtual hugs to everybody. Stay well, and stay together and stay well.
Okay, take care. Be safe.
Thank you. Typically, Children's Healthcare Canada hosts our Spark Live webinar series every Wednesday at 11 Eastern. However, during this COVID pandemic, we're offering special editions of some of our knowledge sharing opportunities. These may fall outside our typical webinar spots, but to stay up to date on all of our activities and events, please sign up for our Children's Healthcare Canada Spark newsletter if you have not already done so. It's always great if you can watch live, as you can have seen that your questions and comments really enrich the discussion. But if you can't watch live, the recordings of these sessions are made available after the fact on our Knowledge Exchange Network. Next week, on May 6th from 11 to 12 Eastern, we are pleased to bring you a webinar not related to COVID, which is nice for a change. It's Beyond Building Blocks, Investing in Lifelong Mental Health of Ontario's 3 to 6-year-olds, with Dr. Purnima Sundar of the Ontario Centre of Excellence for Child and Youth Mental Health, and Dr. Chaya Kulkarni, Director of Infant Mental Health Promotion at the Hospital of Sick Children. So thanks again for joining us today. Thanks to Children's Healthcare Canada members, the Safe Haven Project for Community Living and St. Elizabeth Healthcare for supporting our webinar program, and hopefully we will see many of you back here next week. Bye, everyone.